Joint Commission accreditation for behavioral health comes with one hard truth. After your first survey, the resurvey is unannounced. Be ready any day in the window. Once in the cycle, the triennial resurvey arrives with little advance notice. No long lead time to fix things first. Joint Commission accreditation for behavioral health. What the Joint Commission is, what its standards demand, and how the process actually runs. We cover the accreditor, the standards, the survey process, due status, and what continuous readiness asks of you. The Joint Commission, founded in 1951, accredits over 22,000 healthcare organizations, including behavioral health and addiction treatment programs. It accredits hospitals, ambulatory care, labs, nursing care centers, and behavioral health programs across the country. Its gold seal of approval is widely recognized, and it is often considered the more medical model accreditor compared to CARF. Joint Commission standards leave little flexibility on safety-critical items. Even one missing documentation element, or an expired medication in stock, can be cited as a deficiency. Providers often underestimate the effort and get cited for numerous issues on a first survey. Meticulous mock audits are needed to catch the details. Each requirement for improvement must be answered with evidence of standards compliance within roughly 60 days. The source is direct. A robust EHR can help organize the documentation required to pursue and maintain accreditation. Behave Health is designed to support that discipline directly. The post notes in EHR can be configured to capture and report outcome data rather than tracking it manually. Designed to reduce the documentation burden. Standards-aligned workflows in daily operations keep evidence ready instead of scrambling before a survey window opens. The standards live in the Behavioral Health Manual, the CAMBHC. 3 pillars run through them: safety, outcomes, and trauma-informed care. Miss the emphasis on any one, and your survey gets harder. Here are all 3. Pillar 1, safety and risk management, run through every chapter. Facilities must have protocols for suicide risk assessment, infection prevention, emergency preparedness, and staff credentialing. Standards chapters include environment of care, medication management, record of care, and performance improvement. Pillar 2, standardized outcome measures are required, not optional. A specific standard, CTS 03.01.09, requires behavioral health organizations to use standardized outcome measures for the individuals served. Compliance means collecting and analyzing treatment outcome data and reviewing the national patient safety goals for current applicability. Pillar 3, a trauma-informed approach is explicitly required throughout your programs. Unlike CARF, the Joint Commission explicitly requires accredited behavioral health providers to maintain a trauma-informed approach across their programs. That means training staff on trauma, building a safe environment, involving patients in care decisions, and avoiding re-traumatization. The path to accreditation moves through 3 stages: application, an unannounced on-site survey, and the corrective action decision. Each stage rewards sustained readiness over a last-minute push. Stage 1. Submit the online application and prepare. The Joint Commission uses an online application, the e-app. For new applicants, the survey is often unannounced, within a target window of 6 to 12 months. Providers typically allow 8 to 12 months. Obtain the standards manual, run a gap analysis, train staff, and conduct mock surveys. Stage 2. A team of surveyors conducts the on-site review. Surveyors may use tracer methodology, review records, interview staff and leadership, and assess applicable standards. An exit conference summarizes strengths and preliminary deficiencies, with the official survey findings report following through the portal. Stage 3. Address each finding and receive the decision. For each requirement for improvement, you submit evidence of standards compliance within roughly 60 days, proof that the issue was fixed. Most organizations correct issues and earn full accreditation without another visit. The cycle runs up to 36 months before a renewal survey. Beyond the gold seal, accreditation carries practical operating value for the organization. CMS recognizes its standards as meeting or exceeding federal requirements, so a survey can satisfy Medicare and Medicaid conditions of participation through deemed status. Many insurers recognize or require Joint Commission accreditation, and it can expedite insurance network credentialing. Some state licensing agencies and managed care companies accept a survey in lieu of their own, reducing duplicative audits. The post is clear that preparation means building standards-aligned workflows into operations, Behave Health is designed to support that documentation discipline directly. A robust EHR can help organize the policies, plans, client records, and outcome data accreditation requires you to produce on demand. The platform is designed to capture and report outcome data, supporting the standardized measurement these standards expect. Building requirements into existing forms and workflows is how teams stay ready for an unannounced survey. Stop scrambling before an unannounced survey. Book a 20-minute demo of documentation built for accreditation readiness at behavehealth.com. See documentation and outcome reporting designed for accreditation readiness at behavehealth.com.